Hey guys, welcome back to the channel. Today I wanted to talk about how CBD oil works with arthritis pain. Now I do get a lot of people that come into the store asking for joint pain relief, or their shoulders are hurting, or their knees are hurting. My dad has knee issues, so he has to get a lot of steroid shots and a lot of medication to help with that. CBD works for him as well. He uses it topically, and he's seen relief. A lot of people that I've talked to has seen relief, or felt relief rather, with CBD oils or topical creams. I'd like to go through this article because it has a lot of good information about kind of how it works specifically with arthritis pain. So this is an article from newsmedical.net by Dr. Lee G. Thomas. Sorry if I misread that, but it's a lot of good information, and I kind of wanted to go over this with you guys together. Now, it kind of explains what CBD is and what it does to the body, and we kind of already know that. So we're going to move on down to how it helps with relieving pain and arthritis. Now, CBD acts via the endocannabinoid system, which is active on receptors found in multiple areas of the brain and at spinal cord level to stop the transmission of pain signals. It is 10 times as active as morphine in its effect on certain types of pain nerve cells, and also produces pain relief in response to stress. And that's pretty interesting that it's 10 times as active as morphine, because if you know anyone, or you yourself have been on morphine, you know that that stuff works. It works very well too for pain relief. So that's interesting. Now, it produces peripheral pain relief as well by stimulation of CB1 receptors. CBD is chemically very similar to endocannabinoids that bind to the endocannabinoid system receptors. It increases the levels of anandamide at high doses, producing pain relief. And anandamide is responsible for our happiness and our uplifting feeling. Uh, so it, so CBD reacts with the ECS receptors and neurotransmitters. So that definitely makes sense. Makes sense why it would provide pain relief. Now, CBD is also a has powerful antioxidant activity, said to exceed that of vitamin C or vitamin E. It's thus claimed to be the first endocannabinoid modulator to be used in patients to relieve pain. Okay, yeah, so that's kind of repeating what they said in the first thing. So we're going to move on to observe actions of CBD. When topically applied in gel form, CBD reduces inflammation and hypersensitivity in rats with arthritis, being well absorbed with little inactivation by the liver. And I think that reason why that is because the bioavailability for topical creams is very low or next to nothing, so it doesn't get into the bloodstream, so it wouldn't really affect the liver. So that makes sense. Now, the absorption is directly proportional to the amount applied, with a potential lower risk of systemic symptoms and increased local levels of CBD. Joint swelling and other signs of joint inflammation were reduced with this treatment. With oral use, too, there is a significant reduction in pain sensation in rat experiments. There is less inflammation and a lower concentration of inflammatory molecules in and around the joint space, which leads to improvements of symptoms as well as preventing joint cartilage breakdown over time. So that's interesting. It actually prevents joint cartilage breakdown. So not only does it improve the symptoms, it relieves pain, but it's actually repairing a little bit. Um, so that's really fantastic stuff. Now, during joint inflammation, synovial membrane cells that are responsible for producing lubricating joint fluid and helping with local immunity are activated and begin to secrete inflammation chemicals, including TNF, A, IL-1A, and others. These increase the sensitivity of primary pain receptors in the joints, but also recruit other cells to enhance the production of these cytokines. increasing the intensity of inflammation. A CBD application appears to desensitize this pain system called TRPV1, thus stopping further pain and progression. Smoking cannabis is a commonly reported method to ease arthritis pain and forms the single largest reason cited by patients for medical use of the drug. In the absence of clinical trials, it remains a promising treatment which should be pursued seriously. So yeah, that's the only thing about cannabis space, is that the lack of trials. As soon as there is more clinical trials that we can test, and so we can get definitive answers. Obviously, CBD or cannabis works differently for different people, so it's definitely a tough space to be in, especially with it coming from being a Schedule I drug and going through the DEA to FDA changes, and basically the regulation behind the cannabis space needs to be reworked vastly in order for more trials, more clinical studies, and all this stuff to happen. Now, it is right. It's right that it's the single largest reason cited by patients to use medical for the medical use of the drug. I have a lot of people that come into the store. I would say more than half are coming in for joint pain or arthritis pain, and they're trying to use less of these prescription drugs that were prescribed to them and use more of natural solutions. Now, I do recommend, obviously, talking to your doctor first about it, because some drugs can counteract CBD, or basically there might be negative side effects when using CBD and specific prescription drugs. So you definitely want to talk to your doctor before you start any CBD regimen, and talk to a few CBD experts as well. All right, so using CBD wisely. A 2017 study performed on behalf of the U.S. National Academy of Sciences found that cannabinoids produced a higher chance of pain reduction in patients with chronic pain. They did not differentiate between THC, CBD, and other chemicals in cannabis. That's an interesting that they didn't differentiate, because there's a lot of differences between a compound with just CBD or a little bit of THC or like 10% THC. There's differences in those compounds, so it's interesting that they didn't differentiate between those, but we'll see how it is. Without high-quality clinical studies on CBD and arthritis, however, it is difficult to predict clinical benefit, to recommend doses for various arthritic conditions or any formulation. Different formulations begin to act as different intervals and may contain other ingredients that act via other mechanisms to relieve pain or inflammation. For instance, pain-relieving CBD ointment could contain methanol or capsaicin as well, both of which are also good at reducing mild pain. This makes it hard to decide how much of the observed effect was actually due to CBD for anecdotal reports, as opposed to properly designed trials. So yeah, especially with the topical creams, like they just mentioned, it can contain methanol, which is a healing property, which reduces mild pain. So it's hard to differentiate between whether or not it was the CBD or was the other active ingredients in the topical cream. And I suppose they could have had some different, like they could have tested like a CBD topical cream and a regular topical cream for pain relief. I guess that would have made more sense to do so. I'm not sure what the variables were in this study, but I'd like to look it up, and if I can find it, I'll put the link in the description for that study. But yeah, so I mean, this is the case for all CBD. A lot of it's going to be anecdotal, but we can use anecdotal as a way to push more clinical trials. So quality check absent. So one of the biggest issues with the use of CBD is that you don't know what you're getting when you buy it. A largely unregulated market has resulted in misleading labels, inadequate or absent quality checks, and undisclosed contaminants or adulteration with THC, pesticides, solvents, or metals, as well as wide variation in the strength of CBD. Thus, it's safest to check the label to ensure that the company involved follows good manufacturing practices and gets the product tested by methods compliant with the following: the American Herbal Pharmacopoeia, and just basically make sure the CBD that you buy comes from a reputable source that has third-party lab testing. Just like with some med, I made a video about it the other day. We kind of went over one of the certificate of analyses for some med CBD. You got to make sure that they don't have any pesticides, solvents, metals. All that needs to be ND or pass. Basically, you just need to do your research. If you're here, you're already trying to do some research. So I know that you guys want to know or want to have the highest quality CBD possible. So definitely, you don't want to go down to the local gas station and grab yourself some CBD oil from a random company. It's just not going to be effective, and you can't think that it will be effective doing it that route. You need to treat CBD like it is a therapeutic drug. You need to know the exact amount you're putting in your body. You need to know what other ingredients are going to go into your body if you're going to try to alleviate any sort of symptoms that you're looking to alleviate. So quality check is probably the most important aspect of purchasing CBD, in my opinion. Dosage of CBD in arthritis is far from clear for the above reasons. Because CBD has not been evaluated for specific conditions at specific doses, it is not possible to give an evidence-based recommendation regarding safe doses. Because CBD is unregulated, sellers can make many claims about efficacy or offer dosing advice with no scientific evidence to support their claims. Most CBD companies will tell you to start off low and increase your dosing until you get the desired effect, which is decent. Definitely you want to talk to your doctor because there are so many factors that go into dosing. Bioavailability, which is how fast and how much of the CBD gets absorbed into the bloodstream. There's your body weight, the current drugs you're taking. So if you're taking like epileptic drugs and along with CBD, you might get some mild liver damage or some enhanced negative side effects like diarrhea or things like that, stomach aches, stuff like that. There's many other factors that go into dosing to get the desired effect, and you want to do your research in order to eliminate all of the negative things that can happen with taking CBD. Right. So using the CBD properly. Some practices are already widely agreed upon among medical professionals with respect to CBD. First, review your purpose with your medical doctor so you can be sure you have tried all other reasonable options. This will also help you to objectively evaluate what benefit you are receiving from CBD oil, which can come quite dear. CBD oil is proved as a capsule, which is swallowed, or as a liquid, which is added to food or water. It can also be rubbed. And yeah, this is just kind of telling you how CBD can be administered and what's the best way to take it sublingually. Don't use CBD instead of disease-modifying drug used to treat inflammatory arthritis. Disease-modifying anti-rheumatic drugs are medications that are intended to not just relieve symptoms of arthritis, but change the course of the disease by reducing the number of relapses and the severity of individual relapses. Exactly. So just what I was saying just a moment ago, if you're taking certain drugs, you want to talk to your doctor before you start CBD because CBD can counteract some of these other drugs. And you definitely don't want to do that, especially if you're taking drugs that do more than just alleviate pain. All right, it's not recommended to inhale CBD oil, though there are a number of vaping devices that offer CBD cartridges. This route has not been tested, and oil vaporizer is typically irritating and damaging to the lung tissue. This may be expected, even even more so in people with inflammatory arthritis. Moreover, a spat of deaths has occurred in people who are vaping and developed acute fatal lung disease. Um, that present spat of deaths was due to different reasons. There was a whole big controversy around vaping because a bunch of people died from lung disease, and that was because the contents of the CBD were not as advertised, and basically there were contaminants in the CBD. So that claim is a little meh. We'll talk about that later, maybe in another video. I might pull up that there was a bunch of stories around that time, so I might pull that up and talk about it with you guys. But vaping it's a double-edged sword. Yeah, you can get some lung irritation or lung damage from it. However, it's got the best bioavailability out of all of the methods of ingesting CBD. Upwards to 50 to 60% bioavailability. It's the fastest and most efficient way to administer CBD. As an example, CBD oil is around 20 to 30%, so it's a little bit less, and edibles are around 10% bioavailability. So they are the worst in terms of efficacy. So yeah, I wouldn't recommend vaping if you have already inflammatory arthritis or lung issues, but definitely talk to your doctor. I can't stress it enough. Talk to your doctor. So let's see. Interactions of CBD with other drugs. Patients with arthritis are often treated with a variety of drugs such as opioids, painkillers, and a bunch of other drugs. So these may have toxic effects if combined with CBD, on which very little research has been done yet. Use of CBD can also increase levels of medication, Coumadin, a blood thinner, to dangerously high levels. Exactly, yeah. So coagulants or blood thinners are definitely not good to use with CBD because CBD also mildly is a blood thinner. So if you're using a blood thinner and you're taking CBD, it could potentially enhance the blood thinning process and make it not a good time for you. Thus, this is very important to inform your doctor if you are considering using CBD so that you may review together any possible drug interactions that could put you in danger. Exactly, and as simple as that. Talk to your doctor, make sure that the brand you want to go with has third-party lab testing so that you can see exactly how much CBD you're taking, and there is no need to see like the companies out there that are mislabeling their products and not testing their batches are the companies that are kind of bringing the whole CBD market back. If there wasn't people taking advantage of the current market, I feel like we would have a lot more studies, a lot more backing behind CBD. But hopefully in the future that'll go away, or not go away, but that'll get better. And once FDA regulations kind of catch up with the market, we might see some very interesting studies come out and some very good news, maybe bad news, who knows. So for right now, a lot of it is anecdotal evidence. However, anecdotal evidence is still evidence. So definitely helps people. So we want to make sure that we're doing it right so that we don't hurt anybody. And that's pretty much the main reason for this. The main reason for this YouTube channel too is just to get that information out there so that people know what they're talking about. But that's it for this article. or journal or whatever it is. um, if you have any questions, or if you have arthritis yourself and if you tried CBD, definitely leave a comment. Tell me how it helped out for you, and what you used, what brand you used. Maybe we can talk about it a little bit. But that's it for me today. If you like the video, please like, subscribe. Definitely helps out the channel. Um, and thanks for listening and watching me today. I hope you have a great day. All right, goodbye.